Hello, my name is Shelley Sowers. I am an instructor with UMA. I currently hold degrees in medical assisting, health service administration, nursing, psychology, as well as business. And today we are talking about questioning techniques, which is so important for anyone in the medical arena, regardless of where you work, whether it be the clinical side or the administrative side. It's important, right? So we are going to look at lots of techniques that will be helpful with different age groups. So let's begin with our agenda. We will first begin by talking about real skill, and then describing the importance of having real skill. Differentiate how closed questions encourage or discourage the therapeutic exchange. And then we will also differentiate how open questions encourage or discourage the therapeutic exchange. So we're going to talk heavily about those open-ended questions and closed-ended questions. Okay, so let's begin talking about what is real skill of questioning. So real skill of truly knowing how to ask questions in a manner that helps the client express the problem that they're having. So all of us, and we all have different personalities. We have different ways that we approach people and do things. But we need to, of course, make sure that we connect in a way with our clients where they can open up. Because what we don't want is where a client shuts down and they're not able to give us any details about the problem that they might be having at that time. So the real skill of this is having that ability to help the client help us, right? By opening up and describing some of the issues that they're having at that time. So let's think about it. Why do you think it is so important to have real skill with questioning techniques? And you maybe could even think about a time where you were the client and the person that was doing the interviewing didn't really have that skill. Or maybe they didn't make you feel comfortable enough to open up, because all of that goes together. So we're going to just take a minute to think about a time where you might have been in that situation and how that affected your confidence with the individual, how it affected the entire interview process or your visit. So keeping in mind how we might feel as the client, but also how we need to interact as a medical professional, let's talk about the importance. So in order to help the client express their problem, that skill with questioning techniques, it must be present. And it really doesn't matter if you are a person that is really, bubbly and really outgoing and that just comes natural to you, or maybe an individual that might be a little bit more reserved. We all can have that same skill regardless of what our personality type is. Just like any other skill. You can master it, just have to work at it. These questions and answers are important for the identification, but also the resolution of the problem. Without that, how are we going to identify, right? How can we identify, or how can we resolve the problem? The questions and answers become the foundation for the client's medical records. So essentially when they come in with what we call the history of present illness, same thing as the chief complaint. The history of present illness is essentially what's going on today. And it pretty much trumps everything else that's going on in that moment, because that's the chief complaint of what they're coming in for. So we have to make sure that we ask enough questions and that they're detailed enough so that we have that foundation, whether you're in the clinical or administrative arena. So let's start off with what a closed question is. Closed questions are useful in collecting information during the client history and are most common at the beginning of the verbal exchange. These are not going to require that the individual be asked the question to enlarge upon the answer. The questions usually begin with do, such as, do you still take your medicine? And you could list this specific medicine. Is, or are. And are answered with a simple yes or no, or it's going to be a really brief phase. So remember, when we think about closed, the reason we call it closed is because it's going to close out real quick, right? It's not something that we're giving them the chance to open up on. We just need a simple yes or no response to that. And that can have some downsides, but there are a lot of questions that simply just need a yes or no. So some examples of closed questions are you experiencing pain now? Now that would be typically a yes or no, but a lot of clients, when you mention pain, if they are in fact in pain, will start elaborating on the pain. And then from there, we can kind of build on that and ask more detailed questions about the pain, such as using a pain scale. That's a really good way to make it objective and measurable. Does it hurt when you raise your arm? So if we ask our client, does it hurt when you raise your arm? We would expect probably a simple yes or no. Can you feel the lump when you are lying down? That might have a little bit more elaboration because it's something geared towards specifics. What time or day did the pain begin? Now notice that question, we're really looking for this to be an objective response. Have you taken your temperature with a thermometer? Yes or no? So what are some of the advantages of having a closed question? We already talked about a few of them, but closed questions are great at helping us find out answers to specific questions that we have. If we can get a quick answer, we can make a very quick decision. Closed questions also help gear us towards probing questions on a topic that may need further detail or clarification. And let's go back to our example list really quickly. If we look down here, now we know that closed questions typically are going to be yes or no, but remember they can also include a brief response. So we have the question here, what time or day did the pain begin? So we're going to expect something really short, such as Saturday afternoon or Monday morning. So notice that it's not necessarily answered with a yes or no, but it is expected to be answered with something that's more brief. So we've talked about some of the advantages. Now let's look at disadvantages to closed questions or of closed questions. Closed questions may not be very helpful when the patient is dealing with a traumatic or emotional situation. And if you've been in a traumatic or emotional situation, you probably understand that. That's a time where you want to elaborate and express your feelings. You want to give a lot of details, a lot of back history. So if you're trying to close that conversation out during one of those types of situations, it might actually come off as rude. In those situations, sometimes we have to let the patient talk a little bit to kind of work through that. If we would like the client to elaborate or express detail, closed questions are not typically going to be useful. The client may feel that we do not care because we are closing the question out, rather than giving them the opportunity to express their feelings and, details about how they're feeling, why they're feeling that way. And like I said, you might get some back history. You might get a lot of details that you didn't ask about, but expect that. And that's necessary in that moment for the patient to walk themselves kind of through those different emotions. Now that we have a good understanding of closed questions, let's jump into open questions. So what is an open question? These are most helpful for therapeutic communication, as they do encourage our clients to identify more of what the problem is. This is their chance to shine, right? They can really elaborate during this time and share their feelings. It's not just that yes or no response like we see with the closed questions. They do not put words into the client's mouths. Rather, they allow the client to express their own thoughts and feelings. And in the medical arena, there's no room for us to put any kind of interpretations or summations or anything that we think the client said. We put only facts. We put verbatim what they say. So it's best to use open questions if you can, because we need those details to be from the patient, from the client. Open-ended questions usually begin with how, what, or could. And we're going to look at some examples of those. So as we see here on the screen, some examples of open questions would be, Could your new job be responsible for a change in your eating habits? And that's gonna probably open up a lot. History of eating, what they've done to try to eat differently. And then next, what foods seem to trigger the need for antacids? Lastly, what did the doctor tell you about this medication? That's going to be one of those clarification statements, right? We want to know exactly what they were told, and then we can ask more questions about what they're doing in response to what they were told. What are some of the advantages of open questions? We've looked at some of those, but let's kind of move into this a little bit more. They can work to help the patient figure out what issues they're having in more detail, and then help us also to figure out what the patient's dealing with. The patient has the chance to express themselves more, and open questions help to obtain more detailed information. Just like with everything else, we have advantages, but we also have disadvantages, right? Got to take the good with the bad. It will take more time to complete interviews. We're going to do this a lot more with new patients or patients coming in that do have new concerns, like a new specific chief complaint that they might have. Answers to questions can go off topic. This is very common, very common. If you find that the client is going off topic to the point where it's not really valuable to what you're looking for or even pertaining to the situation, try to redirect them back to a closed-ended question. Redirect them using a closed-ended question. That will get things kind of back on topic, but also will stop whatever conversation was going on. Because, it's not that we don't want to sit and have conversations with clients. We should build that relationship and that connection. But in some cases, it does become, it can become overwhelming and actually take away from the interview process, not help it. Okay, and lastly, the patient may not understand what questions they're being asked. So whatever questions we do ask, if they are open-ended, make sure they're very to the point, very concise, very clear. And if the patient does need any kind of further clarification, let's just maybe reword that a little bit differently than what we originally did. That tends to help. Now we are going to look at some exciting test your knowledge questions. And this kind of just looks at what we just talked about, but also gets you really thinking about, if this were a client you were working with, how would you approach that situation? Or what would the answer be? So would this be an example of a closed or open question? And it says, are you still taking your medication, Nexium 40 milligrams, once per day? So the medical professional was very concise, very detailed on what they were asking. This would require probably a yes or no. So do you think that's a closed or do you think that's open? And I know all of you are thinking, okay, well, yes or no, that's a simple response. That's going to be a closed. It's going to close things out. We can move on to the next question. And if you're thinking closed, you are absolutely right. And you know what? If you're ever looking at these, any questions, or if you're studying in a book and you're doing questions and you get something wrong, typically we don't miss the same question twice. We learn from things that we might miss. So never see that as a failure, because it's not a failure. It's something we absolutely learn from. Test your knowledge question number 2. Would this be an example of a closed or an open question? Could you list any factors that seem to trigger your headaches? So we're asking them for details, right? Not a yes or no. So what would you think? Closed or open? I know all of you are thinking, okay, asking for more details, client's probably going to elaborate. That's going to require more than a yes or no. That is open. Okay, let's look at the next one. What about this? Are you experiencing pain now? Are you experiencing pain now? And this one's kind of a tricky one, right? Because we looked earlier and we said, okay, well, brief response or yes or no could be closed. But I also see an opportunity here to elaborate. Patient could definitely elaborate here. So we're asking for a closed question or a closed response. That's what we're asking for. However, your patient might elaborate. That still does not change the fact that our question was meant to be a closed one. And if they do elaborate, we want to know about pain. We want to make that objective as possible. Like I said, use a pain scale, use a little happy and sad faces for children. We want them to elaborate on pain, so that's absolutely okay. But we were looking for a closed one there. Our last test your knowledge question. Would this be an example of a closed or an open question? So glad you are here today. What brings you to the clinic today to see the doctor? And we see lots of elaboration, right? That's going to kind of open up a whole variety of different topics about what brings that patient in, along with signs and symptoms and all kinds of different details. So that would be open, as it requires more than a yes or no response. And I hope this was helpful. Thank you very much.